Can you see me and the slides, or how's that work?
I see you on the slides, at least on my view.
Cool.
All right, I think we're live now. So hello, everyone. Thank you so much for joining us for another session with WebCeph S. And today we're joined by Dr. Ayzin, a general dentist from California. So thank you so much for joining us, Dr. Ron. And whenever you're ready, the floor is yours.
All right, sounds good. Hi guys, my name is Dr. Ron Ayzin. I'm from Orange County, California. Thanks for having me. I'm a general dentist, and hopefully I can give you guys some insight into general dentistry and answer some questions. So let's see, I'll get started and we'll just go from there. So I'm going to do a little outline, a little intro. I'm talking about myself, so you guys know who I am, what I do. Then I'm going to give you guys some advice for college. Most of you guys are in college and studying to get into dental school, or might have just graduated and trying to apply for dental school. So I'll give you the best advice that I can that I think is very useful. I'll show you guys some cases that I got. I got 5 cases to show you guys that I think are really cool. And finally, I'll answer any questions or concerns you guys might have. And is my screen frozen, or is it working for you guys?
The screen is working, but I think your camera's frozen.
Sorry. All right. Back on.
Yep, you're back.
All right. So I'm a cosmetic and implant dentist. I'm a general dentist who focuses on cosmetics and implants or oral surgery. That's one of the great things I love about general dentistry, and I'll speak about that in a little bit. I'm from Newport Beach, California, born and raised in Southern California. I went to USC, University of Southern California, for my undergrad. I went to UOP Dental School in San Francisco. Fantastic school. I'm happy to answer any questions about that. I think it's a wonderful school. And then I did a UCLA residency at an AEGD, which is an Advanced Education and General Dentistry residency. And that was after dental school, and I can talk about that a little bit later as well. And then now I live back in Newport Beach. So what is general dentistry? Well, general dentistry is kind of what the name says. It's pretty much all of dentistry is generalized. I love being a general dentist. I think it's amazing because you really can do whatever you want to do as a general dentist. I myself really like cosmetics. I have a lot of fun with it. It feels amazing to do it. And I like oral surgery. So oral surgery is a lot of fun for me. I have a lot of fun doing oral surgery, and which is why I love being a general dentist, because I can do all of that and more. I like all aspects of general dentistry. I like crowns, I like fillings, I like root canals. Just a lot of fun, and that's why I like to do general dentistry, because you really can do whatever you want to do about it. Just depends if you have the knowledge, skill set, and the training to do what you want to do. So like I said, I focus on oral surgery and cosmetics. I do a lot of implants and stuff. I take out a lot of wisdom teeth, and we just go from there. So what education do I need? Well, you got to go to college, or typically at least got to go to college, dental school. And then to get to kind of my skill set that I have, there's a few avenues to go. I did an AEGD, but you can also do a GPR, which is a very similar thing, but it's a group practice residency. That's typically more hospital-based. So you're in a hospital instead of a dental clinic. Or if you don't want to do a residency, you can just get really great continuing education courses. Get really great CE, and you can learn and get training very geared towards whatever you want to do, and just really focus on doing a lot of great courses. That's another way. I've even done a few courses myself that are really amazing, that have allowed me to do some great surgeries that I learned at the course, and then a month later, here I was doing it on my own. Or if you're lucky, you can have a fantastic mentor who can really teach you everything you need to know, and you can skip all that, honestly. If you're lucky, you can have a great mentor who's willing to teach you, and if you're willing to learn and put the work in, they can teach you everything you need to know to do whatever you want. Maybe you want to do implants, you can have a mentor who will sit there and teach you all about implants and teach you how to place implants and help you do it and do the surgery with you and so forth, or whatever else in dentistry. Also, just in general, try to find yourself a mentor who is a dentist who can help you and kind of get you going, because a mentor is super, super helpful. I myself have a few, and it is pretty amazing and surprisingly helpful. Okay. So I was asked what a typical day was for me, and honestly, there is no typical day. Every day is so different, which is why I love being a dentist. You don't know what's going to happen a lot of times. You think you might have one thing on the schedule, but a whole other thing is going to happen. And it's not boring. That's what I like about being a dentist. No day is mundane. No week is the same. You might be doing a lot of the similar procedures depending on what you like to do, but overall, it's just so much fun not knowing what's going to happen and not doing the same thing over and over. If you're in like a cubicle office setting, you might get really bored, but not in dentistry, which is what I love. As a general dentist, I try to be able to provide everything a patient needs in one office. I like to think of it as a one-stop shop. So my patients at my office, they can get their fillings done, their crowns done, their root canals, their wisdom teeth, their implants, their dentures, cleanings. I mean, I don't do cleanings, but my hygienist does. But your cleanings, checkups, anything you want, anything you need, all in one roof. And patients really like that because they don't want to have to go somewhere else where they might not know the dentist or the surgeon or whoever you're referring to, and they might not have that same comfortability that they have with you. They don't want to drive somewhere else, which is what I like. And like I said before, as a general dentist, I end up doing a lot of oral surgery because I focus on it. I'm doing implants. I'm doing a lot of wisdom teeth extractions. It's kind of what my days look like. I'm doing a lot of cosmetics, veneers, and just full mouth reconstruction. Some restorative like crowns and fillings, and even some root canals. I like it all. It's a lot of fun. But this part I highlighted here, the best part of being a general dentist is you can do whatever interests you. Um, if you want to do it, you can. As long as you are comfortable, you're well trained, you're good, you know what you're doing, you can do it. I'm doing big cases that typically oral surgeons do, and I am just a general dentist. But I got specific training that allowed me to do it, allows me to feel comfortable, allows me to treat my patients well, and allows me to become or do great procedures. So as a general dentist, you might like something else and have so much fun with that. And that's what I love about general dentists. And I still get to do everything else that a typical dentist does, which I still find fun and enjoying. Um, so yeah. So some advice that I think is super useful for you college kids or people that are applying into dental school. First and foremost, shadow a dentist. I mean, I know you guys are doing this. This is awesome with today's Zoom world and COVID. This is awesome. You guys get to kind of see what us dentists do or hear about it at the very least and learn a little bit more. But why is it so important to shadow a dentist? Dental schools want to know, do you actually know what it's like to be a dentist? And do you actually want to be a dentist? I love what I do. I am so happy that I'm a dentist. But this job sucks if you don't enjoy it. It is stressful. It's a lot of work. Could be backbreaking. So you have to make sure that you love it. So shadowing a dentist is the best way to know if you're gonna like it. See what your dentist does day to day. See if you can see yourself doing that too. College dental schools want to know if they're investing this time into you to teach you to become a dentist, that you're gonna actually enjoy it and not quit or whatever else. I highly recommend maybe working in a dental office or being a dental assistant if you can. So the person who assists the dentist. So you're chair side, helping out the dentist. So you're seeing what they're doing. You're seeing what they do day to day with their hands, what they do for the patient. I know all my classmates in dental school, the ones that were assistants before dental school, were light years ahead of the rest of us. They were so comfortable and so ready for dental school that their first few months were so easy compared to us, because They already knew a lot of dentistry that we didn't. They knew all the dental terminology that for other people was hearing for the first time. It's like a whole new freaking language. Um, so highly recommend, if you can, assist in a dental practice, or at the very least, find a dentist, ask if you can shadow them. I know there's COVID or whatever now, but a lot of dentists are willing to have you still. Hopefully you can. Keep doing more of these shadowing sessions because these are really great. You get to learn more and more. Really find out and make sure what it's like to be a dentist, and make sure that you want to actually be a dentist, because it's not for everybody. It's an amazing career, but some people are going into it just because they think we make a lot of money. And maybe we do. We make some very solid money. But I promise you, the money is not worth it if you don't love it. Some other great advice is join a pre-dental club if you have one in your college. I was part of a pre-dental club at USC, and it was so helpful. I got such great exposure to dentistry. I got to do some volunteer work through my club. We were connected to the USC Dental School, so I got to talk and work with dental students. So I got to know what their lives were like during dental school. We did these cool little dental workshops where we'd maybe wax a tooth or drill up a plastic tooth or whatever. So it was really cool for me to touch a drill for the first time when I was in college. That was all because of a pre-dental club. And you're with like-minded people who all want to be dentists, and it kind of pushes you to do better, and you also help each other out. So if you have any pre-dental club around you that you can join and you are not part of one yet, I highly suggest joining one. Plus, it looks good on the resume. Also volunteer. Besides the fact that volunteering looks good on your application, you're doing good things. You are helping people out. That's amazing. In dentistry, while we make money, we are still helping people. So this should be inherent in your soul or backbone, if you will. And volunteering gets your feet wet. Maybe ask your dental school if there's any way that you can volunteer, the nearest dental school near you, that you can volunteer with them when they do volunteer work. I've done countless mission trips for dental volunteer organizations, and you get to see more dentistry. You might even do a little bit of dentistry if you're somewhere that's not America. You never know, but you get to have some great experience. And obviously, get the best grades you can. I wouldn't kill yourself over trying to get perfect grades, but the better grades you have, the better dental school you can get into, or the easier it is to get into the school of your choice. By no means does that mean that grades matter the most or are the end all be all. If you don't have the perfect grades, that is okay. Just make your application more well-rounded in other ways. That's okay. But overall, try to get the best grades that you can. So that's all for the application process and getting into dental school. And then there's a few things I want to point out for you guys. While you're in college and in life in general, if you aren't already doing this, take care of yourself mentally and physically. First of all, physically, I think, in my opinion, if you work out or exercise or take care of yourself physically, that really helps your mental health as well. But it's important to stay physically healthy. Dentistry is a physically laboring job. If you are physically healthy, you can work longer, your career will last longer, and dentistry will not be as backbreaking for you. You want to be healthy. If you are not, dentistry might not last as long for you. You might not be able to physically be able to do dentistry. So take care of yourself physically. And of course, mentally, I mean, we all know how big mental health is nowadays. But before then, even, take care of yourself mentally. Take some time for yourself while you're in college or whatever. Hang out with friends. It's okay to go out on that Friday night. You don't have to always study. Go travel. Go and explore. Go do fun stuff. Go to nice restaurants or go get some food. Go out. Enjoy life. Study for sure. Make sure you take care of yourself. Because if you are not good enough for yourself, then you will not be able to do good in dental school. And like I said before, make sure dentistry is something that you actually want to do. That is, I think, the number one piece of advice. If you don't want to do it, or if you're doing it just because it looks glamorous or you think the lifestyle is awesome, and don't get me wrong, I have an awesome lifestyle, But if you're doing it for those reasons, you're not going to like it. You're not going to enjoy it. You're not going to make it through. It's so much work to get there to not love something. So yeah, that's my advice for you guys. So I'm going to talk about some cases. I have 5 cases, dental cases. And by the way, if anybody has any questions or anything, talk to our moderators. They can stop me, no problem. I don't mind stopping to answer any and all questions. And I know we'll have a Q&A at the end. I can answer all those questions at the end as well. But if you have a burning question while we're talking here, let me know. So I have 5 cases. They're all very different. I just want to show you the wide variety of what I do and what we can do in dentistry that's really, really cool. So first case, straightforward cosmetic case. I love the outcome of this. I think it looks amazing. This patient's a 23-year-old girl. She's a beautiful girl, but she hated her smile. In her opinion, and I completely agreed with her, her teeth were too small. She hated the spaces in her teeth. Just because of the gaps in teeth, she looks much more youthful. She didn't want to look so young. She's 23. She looked like she was still in high school because of her smile alone. And she did not like that. She was not confident because of it. She was always self-conscious of her smile, which is not happy. We did here 10 veneers from her second premolar to second premolar. And by the way, I'm going to try my best to not speak too dentally and kind of leave everything in layman's terms. I know you guys are not in dental school yet, so you might not be well versed in dental terminology. So I will do my very best to kind of leave things simple. But if I don't and you guys want some further clarification, let me know. Okay, so 10 veneers, here to here. And I think we got an awesome, awesome result. She's got a much more full, bright smile that looks more adult-like, but still keeping her young. It looks super natural in her smile and her face. Looking at her smile in general, you wouldn't think that these are veneers. There's her teeth, there's a little bit like her face. And she was so, so happy. And her confidence just went through the roof. When we delivered these and then I saw her back for follow-up, she just said how much more confident she felt. And that's what I love about being a dentist, especially one that does cosmetics, is we can give people confidence. Giving people confidence is one of the most rewarding things for me. I think that's amazing. Things such as small as teeth can make someone very self-conscious. On the flip side, fixing it can really make them feel like $1,000,000. And this feels amazing. It's an amazing feeling when your patient is ecstatic and feels confident. And so yeah, she looks great. Smile looks amazing. Nice, straightforward cosmetic case. This next one is actually very cool. I love this case. I wanted to do something I did on my Instagram where I just showed the bottom picture right here, and I put like a poll between these front 4 teeth, their incisors, and I asked which one is the implant. Obviously, you guys know which one's the implant because you have the before and after. I wanted to show you guys just this one, have a little fun, but we don't have that much interaction, so I figured it might not work so well. But anyways, I did on my Instagram, and 85% of people could not tell which one's the implant, which is less than chance, which is amazing. And that's including very, very many cosmetic dentists who could not guess. So it felt great. That's kind of what my signature is. I love having a nice, natural, yet cosmetic-looking smile. That's kind of what I like to go. Make things look beautiful, but still question if it's natural or not even question if that's natural. That's kind of what I like to do. I like to blend things in. So this patient here, she was in a car accident and she lost her front tooth about 5 years ago, 4 or 5 years ago. She had something called a flipper here, a fake tooth that was removable for the whole time. So she had no bone here. I don't have the retracted pictures. If you guys email me later or message me and you guys want to see more photos of the cases, I have plenty more. I just have like these before and afters really for you guys. But anyways, what's it called? So missing front tooth, I did a one single tooth dental implant right here. Um, and she also didn't like her chipping on this front tooth. She chipped this tooth along with the car accident. So I had to go veneer and a dental implant. And let me tell you, one of the hardest things in cosmetic dentistry is matching a front central incisor. These are two central incisors right here. One central incisor implant. That is one of the toughest things to do in dentistry. It took a very long time. It took me 10 months, honestly, for this to get the case perfect. I had to shape her gums, let the implant heal, blah, blah, blah. But end result looks incredible. I think this is a beautiful, beautiful result. Matches her face so well. Such a great outcome. And this is a nice little crossover of cosmetics and implants, and it's a lot of fun. So cool case. Next one, a little bit different, a little more drastic here. Patient had a very, very old bridge that was going from here to here that was rotted away, decayed, just kind of even fell off. That's why he was with me. He was missing a tooth here. All his crowns were, to say the least, really messed up. He had decay everywhere on the upper. I ended up doing one implant here, one implant here, and one implant here. And I did an implant bridge, one single implant, and then I replaced all the other crowns to get his mouth healthy again, get his teeth stabilized, and improve the overall health and function and look of his teeth. And I think it's a pretty nice outcome. I'm not saying it's perfect by any means, but from before and after, I think this is a drastic improvement. I think it looks great overall. Works for him, and now his mouth is healthy again. And look what we can do with implants and just crowns, just replacing teeth, fixing smiles here. You tell me, I think this is a pretty big difference in this guy's life. It's changed because of this. Teeth can change lives. Something so small can actually change someone's life. And that's what I love about being a dentist. This case, I put this case in for a very particular reason. This case I did in dental school, and I want to show you what you guys can maybe do in dental school. The other cases are more advanced that I did outside, of course, but this is a pretty amazing result and outcome that I did while I was a dental student. Really cool, nice looking case. Patient's about 30 years old. And she had an accident as a child, I think around 8 years old, which is very typical, where she fell on her face, and kids fall on their face all the darn time. And you'll be surprised to see how common this happens to people. Now she's 30, the teeth are dead, and they're very lingually or towards the tongue tipped. So you can't really tell in this photo, but they're really tipped towards her hard palate, the roof of the mouth. They're pointed way back, like 4 millimeters away from the rest of her teeth, and obviously way discolored, and they're even slanted a little to her right. This is the patient's right side, by the way. This is the patient's left side, if you guys don't understand that. So they're slanted towards the right. Not very good. Patient hated her smile, was so self-conscious. Felt like she had bunny teeth, just did not like it. So, simple. I did 2 root canals on these 2 teeth, and then we did 2 crowns. I whitened her teeth, and some minor things. She did not like her canines either. She felt that they were too sharp, too long, felt too like vampire-ish / male masculine. I ended up rounding them out a little bit with enameloplasty, which just basically means I'm like touching up the enamel, rounding out the canines. And it really made the whole smile flow better with her lips. Really minor changes. And then the crowns look like they match and fit her smile. They look like one of her other teeth. Really nice smile outcome here. I wanted to get her to do a gingivectomy here, where I'd cut the gums up a little higher here with maybe a laser or something to match the gums of this tooth right here, see if the gums are higher here. That would give me a more perfect outcome. At the time, the patient didn't want to pay for it, so you have to make compromises. But overall, I think this is a great result that looks very nice. And finally, this case, my last case to show you guys, is a big surgery case. I did the x-ray part of it because I have pictures of the actual surgery that look awesome. And if you guys want those photos, you can just message me on Instagram or email me or whatever. I'm happy to show you those photos. I just know some of you guys are not into surgery and might not like the bloody stuff, so I didn't want to overwhelm you guys. So here's just the x-ray. This is something called all-on-4. And I wanted to show you guys this is what you can do as a general dentist if you have the training and expertise. So what happened? The patient had severe gum disease. This man was about 50, 85, 60 years old. Nice guy, pretty good looking actually, but his teeth were awful. I mean, he would be talking, he would bite, and his lower front teeth would be flapping in the wind as he's talking. Every time his teeth would touch, his lower teeth would literally come out, like push out like this. It's insane. So, needless to say, his teeth were hopeless. Nothing we can do to save it. So, in one day, on a big surgery day, we put him to sleep. I took out all his lower teeth. I shaved his lower jaw, the bone, about 6 millimeters. That's why it's nice and flat and all rounded out here. These little things here, that's the tooth sockets where the teeth used to be. And then I put in 4 implants and a prosthetic appliance that replaces whole dentition. And you can only see the part that shows up on the radiograph, the x-ray here, but he has a whole new set of teeth here to give him a whole new set of teeth. Awesome result. I mean, this guy went from having a super unhealthy, decaying, rotting mouth to now his mouth is finally healthy again. It looks great, and it's all fixed. It's all set with implants, so he can still chew, eat, talk normally. He can have steak. He can bite into a burger or a sandwich. He can have a normal life still. It's a big surgery. It's a big investment, but it's a great outcome. And I wanted to show you guys this. This is what's possible as general dentists. We can do so much. We can do your normal fillings. We can go to these cosmetic veneer cases. We can do these big surgery cases. It's all about what you want to do and what you want to learn. And this is a lot of fun. I love this stuff. I think it's really cool. And it just kind of shows the power of dentistry. So a little advice to our future dentists, to you guys, find your why. One of my mentors I was very lucky to have, his name is Dr. Galler. He is the #1 Invisalign dentist in the country, if not the world. He has done by far the most Invisalign out of anybody. And I was lucky enough to have him as a mentor at times. And he shared this quote with me that really rang true inside for me, that I truly believe, and it's kind of my mission statement, if you will, or my why in dentistry. And the quote says, "A perfect, healthy smile enables a person to reach their maximum potential in life." Basically saying, a perfect, beautiful smile gives someone the confidence to allow them to be the best version of themselves. You guys have no idea how many times people go from having no confidence to having so much confidence with their smile. If someone hates their smile, that might mean they hate their face. That might mean they can't look in the mirror. They can't look at people. That hurts someone over the long run. They will not have confidence, and no one likes someone without confidence. You give someone a healthy, beautiful smile, they will now have confidence. And many times, people who have confidence succeed better in life. And it allows people to be the best version of themselves and let them be a good force for the world, if you will. So I love this quote. This is why I practice dentistry. It's my small way to help people. So find your why, but while you're doing it, enjoy life. It's okay to enjoy life while you're doing dentistry, while you're finding your why. Make sure to have balance. It's my advice to you guys. That's pretty much it. Thanks for having me. If you guys have any questions, I'm happy to answer any and all of them. If I don't answer all your questions while we're here on this thing, on this video chat, or if you have other questions later on, you want to know more about dentistry or applying to dental school or whatever, you can email me at my email at ronizin@yahoo.com, which is my name. I will eventually get back to you, I promise. I take typically about 2 to 3 days to get to emails. Sometimes I do same day, but just depends on what's going on my schedule. But I promise I will respond. Or you can message me on Instagram. My personal Instagram is Ron Ayzin, just my name. It's not very dentally focused. It does have some dentistry on my personal Instagram, but not the most. That's more my personal life. But I'm on my Instagram a lot, and you can message me, and I promise I will respond, usually within the day on Instagram. I have an office Instagram that is much more dental focused. You can add us there, dentistry at its finest. Although I don't run that, so my dad is actually a dentist as well, and we have an office together. And so he actually runs that. So if you message that, he'll be talking to my dad and not me. So just forewarning. But check us out both on Instagram. And that's pretty much it. Thanks for having me, guys.
Thank you so much, Dr. Ron, for such an amazing presentation. The second case was my personal favorite, but all five were phenomenal.
I'm glad to hear that. Thank you very much.
So we do have a couple of questions. So someone asked, UOP Dental is known for their 3-year accelerated, which is a little different from the 4-year traditional. So they're wondering if it's a little more rigorous or even competitive.
Yeah, absolutely. Before I answer these questions, by the way, I'll warn you guys, I'm very honest and I'm very blunt. So please ask any questions. I will give you the straightforward answer, no bullshit. Like, you're gonna get the truth. But at least whatever truth that I know. So as far as answering your question, UOP is a 3-year program. I think it is amazing. I loved UOP and I loved having a 3-year program. That's extra year saved is incredible. I mean, I'm out as a dentist, younger than most. Got a lot of experience already, thankfully, and I really am happy that it's a 3-year program. I always joke, I don't even know how they do dental school in 4 years anymore, because we did it in 3. I can't even imagine doing a 4th year. I will say it is very rigorous the first year. The second 2 years are definitely busy, don't get me wrong, but compared to that first year is hellish. You combine the first 2 years of other schools in our first year. So it's very busy, but I wouldn't have it any other way. It was amazing. The people at UOP are so friendly. It's a very family-like environment. It's a great school, and I think they make some of the best general dentists out there. The hand skills that come out of that school, in my opinion, and many others' opinions, are top-notch. It's a great school overall.
Thank you for that. So have you ever thought of specializing?
At a time, I thought I wanted to do ortho or oral surgery. Once I understood what an orthodontist does, I knew I'd be very bored. I like working with my hands. An orthodontist does not do that very much. Ortho is cool, it's just not for me, and so I did not want to do that. And then I know I love oral surgery. I definitely love oral surgery, and I've definitely thought about being an oral surgeon. But if you're an oral surgeon, you're not doing veneers. You're not doing crowns. You're not doing Invisalign. You're not doing root canals. I enjoy all those things. I love doing veneers. I want to do root canals. I want to do crowns. I want to do all the other cool aspects of dentistry. So because of that, even though I love oral surgery the most and veneers and stuff, I did not want to specialize because I didn't want to be put into a box. I like general dentistry because you really can pick whatever you want to do.
That's amazing, doctor. So how did you expose yourself into the field of dentistry? You briefly mentioned that your father is also a dentist, so did that play a role?
So I am definitely more fortunate than some. that my dad is a dentist. I'm actually a fourth generation dentist in my family. So my great grandpa was a dentist all the way down. Um, but I did not get forced into dentistry. I actually just happened to love it. Um, I got exposed early on, so I got lucky like that. But it wasn't until college when I was working at my dad's office helping out that I saw the transformation that he would make for other people and the change in their lives. And so that's kind of what just got me into it. And then from then on, I was shadowing at his office. I was shadowing at other dentists' office because I had a feeling that, hold on a second, I'm gonna sneeze. It's gone. Okay, sorry. I had a feeling dental schools might not believe me that if I was shadowing my dad's office. So I wanted to shadow other dentists and see what's going on, not just my dad. I would volunteer at many dental organizations, and I was at the USC Dental School, just trying to get my beak wet, trying to learn more, trying to get more exposure, trying to really see if this is right for me. And so that's kind of how I got into the world.
Thank you. So, how did COVID impact your life as a dentist?
Well, COVID sucked for all of us. I will say, as a dentist, we were very fortunate that COVID did not destroy us. Took the month off during quarantine. I was only working maybe 1 or 2 days a week, helping out patients on an emergency basis. So if patients needed a root canal because of pain or needed a tooth extracted, they'd call me. I'd come into the office, help them out real quick. Other than that, I was at the beach pretty much every day. After COVID, when they lifted quarantine, we were super, super busy. And thankfully, since then, business has been amazing. For some reason, patients have just been missing the dentist, I feel like. Maybe all the stimulus checks, people just have money burning in their pocket. I don't know. But people have been wanting to come back to the dentist. It's been amazing. So thankfully, we came out of COVID. We're doing well.
So, do you have any advice on how to better our manual dexterity as pre-dental students?
Yeah, that's a great question. I don't know about how I can help you with your manual dexterity, maybe besides like playing the piano or something like that. But a good piece of advice that I was told that I did not do, but I wish I did, and like I learned about it while I was in dental school, was take an art class. Take a ceramics class, like a pottery class, just art of some sort. Because there is so much artistry in dentistry that I was not aware of until I was in dental school that I wish I had done. That'd be very helpful. Just take a 1 semester ceramics class or a 1 semester art class. Like I promise you, like the paint strokes or whatever will pay dividends for you in dentistry.
Thank you for that. I'll probably take an art class next semester.
You honestly should. I highly recommend it.
Yeah. So I think this will be our last question. But if you could give an advice to yourself before dental school, what would it be?
Hmm. Probably the art class thing, honestly. I think that art class, like I wish I did. Or actually another thing, if you can, like I told you guys before, be a dental assistant. Work as a dental assistant. If you know you want to be a dentist, be a dental assistant first. Know what it's like, and you will be so well prepared for dental school. Dental school will be so much easier for you. So on your summer job, whatever. I mean, my summer job was at Haagen-Dazs scooping ice cream. That obviously did not help me in any way, besides having awesome ice cream. But if I was a dental assistant, or if you're in a dental assistant, you can make some money over the summer and prepare yourself for dental school, which will make it so much easier. You'll thank yourself 1,000 times for that.
Thank you for the great advice, doctor. So I think that's all the question we have for today. Once again, thank you so much for your time speaking to us.
Yeah, I'm happy to be here. If you guys want to know any more about the cases, I'm happy to answer any more questions of the cases if you guys have that or whatever. If no more today, you guys have my information. You guys are welcome to reach out. I'm happy to help give back. I had a lot of people help me on my journey to become a dentist. I am super, super willing and helpful, or happy to uh, give advice that if I have any advice on helping you guys forward. So good luck, guys. Thanks for having me, and have a good one.
So thank you everyone who joined us today on our live stream. As always, the post-session quiz will be accessible through our WebCeph website. And if you don't know how to access that, we have a short tutorial video on our YouTube as well. So